Dr. Budoff, what is arthritis?
This is a common question. If you take two chicken bones and rip them apart, that glistening white stuff on the edge of the bone that articulates with the other bone that's really slippery, that's cartilage. That is 100 times more slippery than ice on ice. We can't manufacture anything even close to that. Now, if you took sandpaper and you rub that off until you got bone on bone, that's arthritis.
How do you get arthritis in your wrist?
You can get it a lot of ways. The wrist has a lot of little bones and they all have to move synchronously with each other, like the gears in your car engine, for everything to work well and not to wear down and give you arthritis. So a fracture can give you arthritis. Ligament injuries in the wrist, very common cause of arthritis. You can have metabolic issues like gout that create inflammation in the joint, or rheumatoid arthritis that creates inflammation that degrades the cartilage and will give you arthritis. So there are a lot of different ways to get arthritis in the wrist.
How is wrist arthritis diagnosed?
It's usually a pretty simple diagnosis. You come in with pain and swelling and stiffness, and it hurts and it's tender, and you get an x-ray and you see that the joint space is compromised or gone. Often there's a lot of bone spurs around it as the body tries to stabilize the joint, which is one reason you get stiff. If there's any question about which bones are involved, the CAT scan is excellent.
What happens if you don't treat wrist arthritis?
If you don't treat it, you got what you got. It does tend to get worse over time, like all other arthritises do. You get more pain and more stiffness and more dysfunction.
How is wrist arthritis treated?
Like most elective things, we usually start slow. We start with a splint and modifying your activities. So if it hurts, try not to do it. And an injection of steroid can be helpful for a while. Also, you can try to take some anti-inflammatories, some Tylenol, and see if you can get by with that. Now, if that doesn't work, then you're looking at a surgical solution, unless you want to accept the limitations. What surgery is done depends on what bones are involved with your arthritis. The x-rays, and if you need a CAT scan or even MRI, can be helpful with that. But for the majority of wrist arthritises, a mid-carpal fusion works well, where you take, you remove the arthritic bones, and then you take two of the remaining bones, the major bones in the center of the wrist, and you fuse them together. Past surgeries included the four-corner fusion, which I've done a lot of years ago, and that does okay. But if you just do a limited, just two of the bones, the lunate, the capitate, so lunocapitate fusion, you don't need extra bone graft from the big bone of the wrist, the distal radius, and it's less surgery and it's less painful, and you get back quicker, and there's more motion, and it does better. It's outpatient surgery. It's very effective. You're in a cast for 3 to 4 weeks, and then you go to therapy to maximize how much motion you regain. So whatever type of arthritis you have, we can take care of it. If it comes to surgery, in my mind, the best surgery for not all arthritis is of the wrist, but for most of them, the lunocapitate fusion. Other types of arthritis will need different treatments, but overall, an outpatient procedure can be very effective to treat that.
Thank you for your time today, Dr. Budoff.
Thank you.